Hey guys, so I wanted to get on, start this vlog off with sharing with you guys what I'm going to be doing for this very first cycle of trying to conceive since getting my excision surgery for stage 3 endometriosis. My doctor did clear me to start trying to conceive this cycle. I had my surgery exactly 2 weeks ago, and in about a week I will have my fertile window. So I had my surgery 2 weeks ago, and I just finished my period on the 2nd. Today's the 5th. So, gearing up for stuff. This cycle, my doctor did allow me to do a medicated cycle with Letrozole. I'm alternating 2.5 and 5 for days 3 through 7. So, basically taking it from days 3 through 7, one day 2.5 milligrams, the next day 5 milligrams, next day 2.5, next day 5 milligrams, and so on and so forth until I finish all the medications. And then I'm gonna also just be testing, with OPKs to find out when my ideal time to do the deed is, and fingers crossed that this is our cycle. So I'll be keeping you guys posted, taking along the journey. And so in the rest of this vlog, you will see my testing, line progressions. I'm also on Monday the 11th, so next Monday. Today's Tuesday the 5th, and then so next Monday the 11th, I'm going to be going in for a antral follicle count to find out how the Letrozole is working for me. So I'll keep you guys posted on that too. I don't know if I'm going to film that, but I'll keep you guys posted on what they said. I had an antral follicle count done in the beginning of this month. I had it on day 1 of my cycle, and they said they saw a total of 9 follicles, so 5 on my right ovary, 4 on my left. I guess for my age, I'm 30 years old. That's a little on the low side, but nothing to be too concerned about. So that's the news for now, and I'll keep you guys posted on my LH tests as well as what they say at my next ultrasound. What's up, guys? Good morning. Today is cycle day 9, and I started doing my OPK tests. I have the easy at home ones that I'm doing that are just like the little strips that I'll show you an example of one. Just the little strips that you, let's see if you can see that. That kind of just show you like a little blank, like the lines, and some people don't like to do this one because they say it's more confusing. Why is it not focusing? Whatever, you get the point. It's like the strips that you basically watch to find out that once the first line is as dark or darker than the second line, that means that is your peak. But I'm also doing the clear blue digital because I don't know, I have a weird feeling about this cycle. It's my first cycle since the surgery, so I want to give myself as best of a shot as possible to get pregnant this cycle. So I want to, at least for the heck of it, this first cycle, just see like what's the accuracy between what I see on these, cheapy OPK tests and then what I get from the clear blue. And as you can see, I haven't tested with the cheapy yet. I'll do that in the afternoon. But with the clear blue, you want to do first morning urine. And I'm getting a flashy smiley, which means high fertility. So when it's solid face, that's peak. But that's kind of crazy because I'm on cycle day 9 and I wasn't going to test this morning. I was actually going to wait till like cycle day 11 to start testing with this. And I'm glad that I did because, as you can see, high fertility. So pretty excited. I might have to move up my follicle scan because my follicle scan's not till Monday, which is my cycle day 12. But if I'm already getting high fertility, maybe I should mess with my doctor and see if she wants me to come in today or maybe even Saturday if they're open. I don't know. I'll keep you guys posted, but wanted to share that with you guys. So yeah, we're on cycle day 9 today, and I just tested with my OPKs, and I'll show you guys later what the ovulation test, the cheapy shows, so you can kind of see like, am I getting even a higher reading on that, and is it somewhat accurate or not? But on Clear Blue, I'm getting a high reading. So super excited. Talk to you guys soon. What's up, guys? Just wanted to update you on what's going on today. It's Saturday. I'm on cycle day 10, and my reproductive endocrinologist bumped up my follicle scan to today. I've been getting high readings on the Clear Blue Advanced, but still like very, very faint lines on like the regular OPKs, like the cheap ones. So I'm definitely glad that I bought the more expensive ones. But yeah, wanted to update you guys on that, and then I will get back on here and let you know how the follicle scan went and what they saw. So talk to you guys soon. Just about to get it done. So excited. Fingers crossed that I have more than one follicle. What's up, guys? So I just got out of my follicle scan, and basically she said that I'm no longer going to trigger. She thinks that I have plenty of time to just do it naturally, because I'm only on cycle day 10 and I typically don't ovulate till day 14, 15. She saw 2 follicles on my left ovary that measured 20 millimeters and 24 millimeters. And I guess the ideal number that you want your follicles to be for ovulating is between 18 and like 22, I think. And then on the right side, there was a 12 millimeter one. So she's like, I don't want you to trigger now because of the fact that there's one that could still be, you know, a potential for growth on the right. So it's just a waiting game now. I'm glad that they saw more than one, but fingers crossed. Definitely don't think twins will come out of this, but fingers crossed that we get pregnant this month. What's up, guys? So I wanted to show you. So I took the Clear Blue Advanced test this morning, and it was still a high reading. I've had, I think, 3 or 4 high days so far. And I took a regular cheapy OPK this morning, and it was, this is how dark it was. The first line is what you want to look at. So it wasn't very dark, so definitely don't feel like I was gonna have a peak today, but I've been having a lot of cramping and like feeling just kind of ugh. So I decided, usually with these cheapy ones, they recommend you take your tests in the afternoon, unlike the Clear Blue Advanced that say you have to do first morning urine. And I just took one, and look how positive that is. Blazing positive. So usually when you get a peak OPK, that means you're going to ovulate in about 12 to 36 hours after you get that. So yeah, just thought I'd share that with you guys. I'm on cycle day 12. It is, I think, about 2 p.m. in the afternoon. I just took that, and it was blazing positive. So fingers crossed that this works this time. I'll keep you guys posted on when I decide to start my progesterone supplements, and then I'll also keep you posted on pregnancy tests. What's up, guys? So cycle day 13, I got a peak reading on the Clear Blue Advanced. I showed you guys last night. I had a peak reading on the cheapy OPKs, and I'm definitely thinking that today, cycle day 13, is ovulation day, because holy shit, dude, my ovaries are so swollen. I feel like I'm gonna throw up. My head hurts. I'm cramping like crazy, like so much pain. And honestly, like anyone with endometriosis will understand this. Like I haven't had too much pain since my surgery, but it feels a lot like that endo pain, like super deep through your back, through your bowels, through your freaking urethra, just tension, just tightening up. And it honestly puts my body into like almost like PTSD. Like I start getting like anxious and sweaty, and like my heart starts palpitating because I'm anticipating like a lot of pain, but I know it's probably just, you know, my first ovulation back since surgery. Things are, you know, different down there now, so I don't know. Maybe it's just more intense, plus being on the Letrozole is probably making it more intense. But holy crap, man, this is... Man, whatever happened to, you know, being young and like praying that you didn't get pregnant, and like now doing literally everything under the sun to try and get pregnant. Like even though I feel like absolute crap right now, I know that I'll do it again next month if I'm not pregnant this month. So let's all pray together. Let's say a little prayer real quick that I am pregnant this cycle, because I'm ready for my baby, and I'm just so sick of being in uncomfortable pain. And I will gladly, in my pregnancy that unfortunately turned out ectopic, that pregnancy, holy shit, dude. When people say morning sickness is a thing, yeah, it's not just morning sickness, it's all day sickness. You feel like death. And I'm ready for that as long as I have a baby in the end of 9 months. So I'm not worried about being in pain or being uncomfortable, but I'm just really hoping that this means it's really working. I'm ovulating really well, and we get pregnant this cycle. Fingers crossed, because the next couple clips you'll see after this is going to be pregnancy tests. Let's pray for 2 lines. What's up, guys? Good morning. So, had probably the most painful night of my life last night. I think I ovulated last night, or I'm ovulating this morning. I don't know, but all I know is the pain I was in last night from whether it was the Letrozole or a combination of Letrozole plus this being my first cycle after my surgery. It was the most intense, excruciating pain I've ever experienced in my life. But feeling better this morning, hoping to God it doesn't come back. But I wanted to show you guys my line progression so far. So, let's see if I can. That is what my line progression looks like for these cheapy OP cases. You can see I don't have like anything on here that like leads up to, oh, it's getting a little darker and then a peak. It's like almost like kind of the same, and then boom, peak. So this is why I test. Some of these days it's not like that's every day. Some of them are every like 2 tests, sometimes even 3 tests in one day, just because I have to track that diligently just to catch my LH surge. And then so I got my peak reading on those cheapies on cycle day 12 at night, and then I got my peak reading on the more expensive Clear Blue Advanced digital test on cycle day 13 in the morning. So for us, what we've been doing is we've been having sex every other day, and then when I got my peak on the cycle day 12, we had sex cycle day 12, cycle day 13, so yesterday, and then we'll probably do it again today, and then we'll be done, because I'm in so much pain that this is not this is not as easy as it seems. But you know, it's crazy that we spend, you know, I think I said this in the last clip I was in, that we spend all this time when we're younger trying to avoid getting pregnant, and then unfortunately if you have a disease like endometriosis, you learn really quickly that getting pregnant is not going to be maybe that kind of laid back easy way that you think it was going to be, especially if you have like a plan with your doctor to get pregnant before your disease progresses to anything worse. So, you know, we're definitely hopeful that this cycle works for us, but we're not going to get discouraged if it doesn't. But after going through last night, I definitely think I might take a break from the medication, because I think it increases the chance of pain during my ovulation, especially this close to my surgery, because that was just unbearable. Like, I was literally like seizing. That's how hard everything was contracting in my like pelvic area, and it was just so shocking pain that I like, it would take my breath away, and I just don't know if I can do it again. But we'll see. You know, once this pain passes, I'll probably feel just much better, and I'll do it all over again. It's crazy what us women will do to have a baby. But I'll talk to you guys later. The next couple of clips are probably going to be me sharing pregnancy tests. So fingers crossed we get 2 lines. What's up, guys? So today is 3 or 4-ish days past ovulation. Sarah, knock it off. And this is the time during the 2-week wait that it's the most difficult, because like right now it's like you don't know if you're pregnant, you don't know if you're not pregnant. I won't be able to really test until probably 10 days past ovulation, but I really should wait till like 12 or 13 when I miss my expected period. But I'll keep you guys posted on how those tests go, or if I decide to test really early. But praying so hard that I'm pregnant. What's up, guys? It's the morning of cycle day 8 DPO, 8 days past ovulation. Sorry, I look like crap right now because I'm just exhausted. I've got these little bumps that keep popping up. I caved and I took a pregnancy test this morning at like 4 a.m. and it's negative. And what's hard is like when you've been doing this for as long as I have and taking as many pregnancy tests as I have, you see lines that are not there. And so like I could have sworn, I'm like, I swear I see something. But every time I look back and I'm like, no, it's dark white. So, and honestly, 8 days post ovulation is a little too early to take a test. I told myself I would wait till 10 days past ovulation, but I caved. So we'll see if I can help myself from not testing tomorrow. Probably won't. I probably will test, but I'll keep you guys updated on the next couple of tests I take. Good morning, guys. So on my Premom app, it says I am 9 DPO today, and on my Glow app, it says I'm 8 DPO today. Like I said in the last video, maybe I'll wait, but I'm not going to wait. So I'm going to test right now. I think a lot of like, you know, everyone always tries to look for like symptoms. I think I'm like reading too far into stuff because right now it's super dry and windy over here. And I have like the worst like sinus cold ever, but I've heard of people getting like sick or colds like, and that end up meaning that they're pregnant. So I know I'm like reading too far into this. Okay, so I dipped it, so I'm gonna take the thing off just to see if I see anything. And again, I'm having the same issue I had yesterday where I feel like I do see something, but I don't think I see something. And I know you all know what I'm talking about. Like I feel like I totally see a line, but it is probably the faintest line you would ever expect to see in your entire life. Oh my God, see, like the longer I look at it, I'm like, yeah, I see something. And then I look at it again, I'm like, nope. Guys, so I just want to get on. Today is 10 DPO. I took a test and it's stark white, not even a hint of a line. Because I'm on progesterone suppositories, I will be taking those for another couple days, testing again, and if it's negative, I have to stop the progesterone suppositories so that my period will start. I've decided that I think I'm going to end this particular video here, and if by some miracle I have a positive test come up in the next couple days, I'll definitely be sharing that video with you guys because I'll still be filming it. But you know, quite a few things have happened recently. I feel like crap lately. I've got all these like pimples on my head that I normally don't ever get, so I don't know where the heck that's coming from. And my doctor thinks I have COVID, so getting that test done today. Hoping to God that that's negative because that'd just be one more thing added to my freaking list, but yeah. Unfortunately, I wish I could have better news right now. I don't mean to end this little first cycle video on a negative note. I'm just being very real. I just don't think I'm pregnant at all, but the next video I post will either be me starting cycle 2 of trying or sharing some good news. So we'll see, but thanks for watching, guys. Bye.